Today, it's my pleasure to introduce Lisa Honka. I met Lisa at an event in the Villages a few weeks ago. I listened to her presentation and thought that she would be a perfect guest speaker for our group members. She has a wealth of knowledge. Although she's located in Villages, Florida, she can help anyone in the state of Florida, as well as to help those in other states with all of her connections. Lisa is the founder of Your Key to Senior Living Options. She's a senior living advisor. She's had a career as the director of sales and marketing in the assisted living industry. Lisa felt her true passion was to help those trying to navigate the journey of transition and educate families about the necessary resources available to them. Since each case is different, Lisa helps to craft a personalized plan for each family she serves. She has a team that works together with her to help find the correct supportive community the first time around. Helping to remove some of the stress that families experience is one way for families to make their best decisions that they can. She has helped thousands of families and is here to share her time and talent to help you gain some knowledge that might make your personal journey a bit better. We'll have those questions at the end. So for right now, let's listen in to Lisa's well-prepared presentation. Lisa, I thank you for being here today, and I am going to hand the meeting over to you.
Thank you. So my name is Lisa Honka, and I have a company called Your Key to Senior Living Options. I live here in the Villages. I started my company 6 years ago because I realized how complicated it was for families trying to navigate all the different resources that are out there. I have now a team that work for me, which I'm very blessed to have. Josephine actually came from the Council on Aging in Maine. Bonnie, who works for me, she's been working with seniors for 25 plus years. Maureen does all my beautiful marketing materials, helps me with my PowerPoints, which you'll see. She did an amazing job on this one. And then Paula's my admin. So again, wonderful people helping me serve the families that call me every day. On average, I have about 1,000 families call me a year now. So we meet with them, discuss what the options are, and that's where some of this material has come from, is actually conversations. I've created a lot of marketing materials based on the questions that people have asked me. So what is a senior living advisor? So a senior living advisor is very similar to a social worker or a case manager. What I try to do is hear people's stories, understand what their care needs are, what their wishes are, what their desires are, if they need to go to perhaps independent living, assisted living, memory care, maybe start with home care. Maybe sometimes even the families that I'm working with want to know about their long-term care insurance, their veterans benefits. So a lot of things that we talk about are just big and broad, like have you done your legal papers? And then we kind of zero in on what are their wishes. Is it to stay here in Florida? Is it to move near your family? So again, a senior living advisor pulls everything together and maybe has you think about things that you hadn't thought about and perhaps even get your ducks in a row. So that's what my job is just to work through the what ifs if something does happen and kind of prepare for your plan. And we know, again, as caregivers, the what ifs can happen at any time. And so it's just having that plan. If something happens to you as a caregiver, you have to know what your plan is going forward. We always have to sort of have plan A, B, and C. And that's what I help people design, is the plan for today, perhaps short-term plans, long-term plans, and zig and zag as life kind of throws up the curves. Go ahead, next slide. So who needs to know your plan? And a lot of this is about, again, pre-planning. Do you have a partner that needs to know your plan? Your children, your siblings, your attorney, guardian, neighbors, friends, financial advisors, fiduciaries, trust officers. Many people in the Villages moved away from their family 20, 30 years ago, and they don't have people sometimes to navigate for them. They didn't marry, or maybe they were married and they're now single. maybe they had children, didn't have children, estranged from their children. And so trying to find the person who could navigate for them in an emergency is really important. And that's sometimes the calls that I get. I had a woman call me on the way home from a meeting I just had, and she said, I am living in my apartment. I have COPD. I got your name from the Parkinson's group, and I need to do something immediately, and I have no one. And she started to cry, and she said, I hope you can be that some person that can help me get to an apartment that I can afford and a place that will keep me safe. So again, sometimes people don't have someone, and my job is to try to figure out who that could be, whether it be a neighbor. And again, plan for the future. What kind of plan do we need to have going forward? So next slide. So again, who is your circle of support? Your financial advisor, who perhaps it's the social group in which you participate in, a senior living advisor, your doctors, perhaps, again, do you have emotional support, legal support, financial support? So again, who are these people that help you put together your plan for life, and what does that look like? Next slide. So again, one of the things that I talk with families immediately about is who has done your legal papers in Florida. It's really important, as you all know, and again, wherever state you're in, is to have your legal papers done when you do come to a new state, so that if something happens to you, your estate doesn't end up going to probate and is locked up for a year and a half. So again, making sure that you have your living will done, last will and testament, guardian papers if you need that, making sure that you've created a trust, so that, again, one less thing that you have to worry about in the future. Next slide. The other thing that I'm always talking to families about is, do you have those people authorized to be able to speak to your doctors, such as, again, your healthcare proxy? Have you registered with the hospital? Have you registered with your doctor? Does your long-term care insurance know who they can speak with in an emergency? Do you have advance directives? I was meeting with a family this week, and I said, your wife has lesions in her brain. She has COPD, she has advanced dementia, and it might be a good time now to see if perhaps she can tell you how much extraordinary means you want to take at end of life. You could talk about yours, and perhaps maybe she could talk about what her wishes are. So again, what are your advance directives? What kind of intervening do you want to do at end of life? This is really important for, again, kind of getting your ducks in a row. Next slide. So again, one of the things that I work with when I'm working with families is, if you needed care in a minute, even home care, or if you were thinking about respite care for you as a caregiver, where would you get the money from? And so we work through, is there money in your home? Do you have savings, investments? Are you a veteran, and maybe we can get some aid in attendance benefits in your home? Do you have a long-term care policy in which maybe we can get some home care started in your home, and long-term care will pay after your elimination days? What is your Social Security pension? Are you thinking that your loved one who has, again, Parkinson's, MS, perhaps Alzheimer's, might someday need to go on Medicaid? And should we talk about that years in advance? So these are some of the things that I talk to families about, is just, again, getting your ducks in a row and planning for the future. And then again, are they disabled? Could they get a disability benefit from the VA that they had not thought of because of, again, a cancer diagnosis or perhaps loss of hearing? Next slide. One of the things that I created is this what to put in your emergency binder. And if anybody's interested in this, they can certainly go on my website or contact Sherry, and Sherry can forward this to them. This is something that came out of, again, meeting with many, many families and saying to them, do you have an emergency binder? If something happened to you at 2 a.m., do your neighbors who are going to come in contact with you first, or perhaps those 911 workers that come in to take care of you, are they going to know who they should contact, your friends, your family. Do they know where your living will is? Do they know your medications? Do they know who your life alert information? And again, if your children came down here, do they know about your long-term care insurance, the banks in which maybe you're going to use some money for to keep the lights on while you're gone if you have an emergency and end up in a hospital and then a rehab for 3 months. So again, this is again an emergency binder that I suggest everybody over 65 start to create, so that again, everything's all in one place. Your pet information, your DD 214 if you are a veteran, and then information on, again, assisted livings. Perhaps you've toured a few, perhaps maybe there's some that you have met perhaps in the past, maybe a home care agency that you used. And again, their information can be in there, because if you are going to a hospital and then followed by a rehab, you may have a preferred home care agency that you've used in the past, or a home health company that could provide therapy in the house that you prefer. So again, in this binder has a lot of information, and then again, final arrangements. So again, I always encourage people to create this emergency binder. And again, if you're interested in this information, Sherry, I can certainly send you a copy of this, and then you could forward it to your contacts and they can have this as well. One of the other things, next slide, that Maureen created for us was this emergency toolkit. So sometimes it's hard to find the time to write down, oh, this is my daughter's number, my doctor's number, these are all my medications. And I have a downloadable PDF that, again, I can forward to you, Sherry, and you can forward to your contacts. And it is, I think it's 9 pages, and it just has line by line by line, you actually filling out the information so that it's, again, this can go into your emergency binder, and it's much simpler to sometimes fill out the line items than trying to figure out, oh yeah, I forgot my daughter's address or zip code or her new email. Okay, next slide. Again, when I'm working with families, the things that I ask them are, what are your care needs? What kind of things are going on at home? Are there escalating care needs? Have you been newly diagnosed with something? What's your desired location? Is it to stay in Melbourne, Florida for the rest of your life? Do you have children up north that perhaps you want to move to? Or is it possible that, again, maybe your adult children are going to be moving in with you for perhaps some care for a short term? Again, if you have a procedure or hospital stay, would they come and take care of you for a while? These are some of the questions that I ask as people are kind of beginning to think about what comes next. And then what kind of support do you need to stay safe? What does that look like? So are you going to need a little bit of therapy? Are you going to need perhaps to move to an assisted living because you're having trouble managing your medications, you're having some low vision, some balance issues? So again, these are some of the things that I ask families when I meet with them is your desire to stay home, or are you starting to think about maybe a senior living community, even in independent living? You're tired of being alone, you're tired of cooking, tired of the house maintenance, and perhaps maybe simplifying things so you can just have fun. Next slide. So again, with being caregivers and being this sort of leaning a little bit towards a support group, I wanted to kind of talk about what are those tipping points for perhaps moving someone to memory care. And these are some of the identifiers that we've identified through the years. Again, caregiver stress. So again, it's hard on caregivers, and we're going to talk a little bit about that in a few minutes, about the escalating care needs and the stress of being a caregiver. But again, one of the reasons that someone does eventually move to memory care, have their loved one move to memory care, is, again, the stress. Sometimes there's agitation, again, that person not really recognizing who you are, or again, just day to day, the sundowning sometimes causes them to be quite stressed. Sometimes home safety, again, wandering, that's one of the reasons that people begin to think about it's time to move someone to memory care. Perhaps sundowning, wander. Again, we know 60% of people eventually do become wanderers. And in the villages here, during the pandemic, they had about 250 cases of wandering. The average person was gone 45 minutes. The longest person was gone 4.5 hours, and the least time was 15 minutes. So again, there's quite a range of time in which someone was gone. I was actually meeting with a family a couple of weeks ago. I was meeting with the daughter and the wife, and I said, gee, I know your husband has some memory loss. Should you be leaving him? And she said, well, he's never wandered. And I looked at her and I said, yeah, he's not wandered ever yet, but he may. And they assured me that because of his low mobility, he would definitely not be wandering. And unfortunately, I got an email from them when I got home saying that he had wandered. He wasn't home. He had wandered by golf cart, probably about a 20-minute golf cart ride away on the streets, not using the golf cart pass. And they found him at Lake Deaton Center by chance, because the daughter had put a Apple iTag in his golf cart. And when the wife said, well, where did you go? And he said, well, I was looking for you. And she said, well, did you use the golf cart pass? And he said, no, I didn't know we had them. Well, he's lived here for 8 years, so there's no reason he didn't know them. He's used them hundreds of times. So again, wandering is one of those catalysts for moving someone perhaps to memory care. And again, changes in behaviors, escalations, hallucinations, paranoia, sleep problems, getting your days and your nights confused, the constant asking of the same questions over and over again, confusion, disorientation, declining in health. Again, when somebody becomes a one-person assist, resisting, perhaps taking showers, just again, more difficulty transferring and walking and getting in and out of showers, in and out of cars. Sometimes that takes a toll on the caregiver, who could also be in their 70s, 80s, and perhaps even 90s. And then incontinence, again, changes in incontinence sometimes pushes people over the edge because it's just one more thing that they have to deal with on a daily basis. And then again, typically it's something in your gut saying, I think it's time. I have to listen to my instincts. This caregiving is becoming more than I can manage. So again, those are some of the reasons that people move someone to memory care. Next slide, please. We know that the health of caregivers is in peril sort of from the beginning. 53% of caregivers indicate that their overall health is compromised because of, again, being a caregiver. 14% of them report that they have 14 or more mentally unhealthy days in the last month. That's a lot of mentally unhealthy days. 17% of caregivers report 14 or more physically unhealthy days. Today, I was meeting with somebody whose husband is in memory care. I helped her get her husband in memory care. He'd had some massive strokes years ago, falling all the time. And I said, our goal right now is to keep your husband in memory care. I know it's expensive. I know you want to bring him home. He's pressuring you to bring him home, but you need to have back surgery. So our number one priority is for you to have back surgery in April. And then in May, we're going to regroup and figure out how you're doing going forward. Has he gotten better being in the assisted living and getting therapy? And is there even a possibility now in your new condition of bringing him home? So again, physically looking at the caregiver and saying, how are you physically doing? And is it possible to continue? And then 37% of caregivers report inefficient sleep. And we know that sleep is really important to our overall well-being. So again, these are some of the things that affect caregivers. And this is some of the catalysts for moving someone to a memory care. Next slide. Again, when we work with caregivers, 40% of them have 2 or more chronic diseases. So again, heart conditions, COPD, high blood pressure. These are some of the conditions, again, that people have. And 53% of the caregivers, 65 or over, have more chronic diseases compared to the caregivers who are under 64. So again, the older you get, the more chronic diseases you have. And is that related to just natural aging, or is it moving forward faster because you're a caregiver and under stress all the time? 14% of the caregivers report coronary artery disease or stroke, and 22% of caregivers 65 years old or older report coronary artery disease and or stroke, and 10% of those caregivers in the 45 to 65% age are reporting coronary artery disease. So we see, again, as they're aging, they're becoming more and more frail, and perhaps related to caregiving. So again, looking at men versus women and the coronary artery disease, we see that the older they get, the more likely it is that there'll be more comorbidities for those caregivers. Next slide. So again, how do we reconcile our role as a caregiver? And again, I'm slanting this more towards the support group, and how do we take care of ourselves as caregivers? So again, you reconcile the role and validate the extra responsibility. This gives you a sense of ownership and a control to reducing some of the stress. Redefining success. So success can be just having a good morning or a good afternoon, or maybe a couple good days in a row. But again, we know things are going to happen, and just defining success in little pieces, and trying to stay positive throughout all of this. Kind of trying, again, looking to journal things, saying, in that journal, what went well, what kind of positive things happened that day. That helps us remind us of how important our role is, and how we can look at the little things as positive successes along the day. And then looking forward, where do you want your life to be when you're done with caregiving? What does that look like? Even if it's starting to plan perhaps a vacation, a couple days away, a weekend away, a half afternoon away, what does that look like? So looking forward when you're in little pieces, not a caregiver for a couple hours, not a caregiver for perhaps a night, or not a caregiver for a little time when you're having vacation. But also, again, some of the people that I work with are profoundly very young, and they are caregivers to a 70-year-old, and there's a lot of life to be living. And what do you want your life to look like going forward? One of the things we encourage people to do is create a sanctuary. So where is that? Your office space, outside on the hammock? Is that in your golf cart going around to see nature? Is that sitting by the water and maybe fishing? What does that look like? Going to a club even, right? Getting out and doing some exercise. Where is your sanctuary so that you can sort of pace yourself for this journey? And finding ways to deal with the grief you're experiencing, going to a support group. And that's why this is so important, is sharing your feelings, understanding, that sometimes you are helpless and that you're tired. Weary, I think that's a good word to use, is weariness of caregiving. So again, finding that support, and then acknowledging when you're not okay, when days haven't gone well or things aren't going well, just acknowledging that and saying, this is how I'm feeling, is incredibly important, and finding those people that can support you on your journey. And then recognizing the signs of depletion. When are you losing your temper? When have you not had good sleep and you're burning out? These are important things to recognize is the signs of depletion, so that you yourself do not burn out as a caregiver. Next slide. So again, figuring out the resources is like putting the pieces of a puzzle together. And that's what I hope that, again, my presentations and meetings with me help do for families. Next slide. I'm going to go through, again, some statistics. And again, some of you already have loved ones in senior living communities. So this is sort of an overview of how do I afford a community. So again, when I work with families, I'm looking at what do they bring in Social Security each month, pension, savings, sale of a house, long-term care insurance, aid in attendance, benefits, Medicaid, accelerated death benefits, life insurance policies. I'm going to go a little bit into some of these. But again, if you have any questions, you can certainly reach out to me, and I can send you some information on some of the, again, information about long-term care insurance or aid in attendance, questions to ask. All right, next slide, please. So again, when people are thinking about and I have a lot of families call me saying, I'm not sure we're ready for memory care. I can't afford memory care for the next 10 years. What are we looking at? And so this is just national averages. What is the average length of stay in memory care in the United States? It's 17 months. What is the average age of a resident in communities? In memory care, it's 85 years old. So this is the average age of someone nationally, right, across the country, moving to memory care in the United States. And this is good to know. So if you're 92 years old and you're moving to memory care for the first time, or moving someone, or your brother's moving to memory care and they're 92, are they going to run out of money? Statistically not, because life expectancy is 85, and statistically they're there about 17 months. Next slide. So according to the CDC, how long should I budget for? And again, these are life expectancy numbers. So nationally in the United States, a woman's age currently past COVID is 79.9. A man is 74. So when I'm working with a 95-year-old who needs to go to memory care, is it likely that they're going to run out of money if they have a couple $100,000? Not likely, because of, again, if you look at the life expectancy tables, they are older than the average person moving to assisted living, memory care, or the national average for life expectancy in the United States. Next slide. So again, this is just an example. This is Joe, 82 years old with moderate to severe memory loss. He has $2,500 in monthly income, pension of $500. He needs to go into a shared apartment because he doesn't have a lot of money. So again, these are numbers here in the Villages. Cost per month is about $4,500 for a shared apartment. That's care all inclusive. He brings in about $3,000 in income between his Social Security and his pension. He has a $1,500 gap. He has only savings of about $75,000, but if we took the gap divided by the $75,000 that he has in assets, he has about 50 months worth of money, which is about 12 divided by 12 months. So how many years worth of money does he have? About 4 years. So again, is it likely that he's going to run out of money at 82? Probably not. And again, this is just kind of showing you, sometimes people are really scared by those numbers of memory care. And sometimes when you really work them out on paper, it's actually more doable than you think. Next slide. So again, one of the things that I talk about in this presentation, I'm going to talk a little bit about options. So what's available? Home care, assisted living, memory care. Oops, we got home care twice there. Daycare, respite care, and long-term care facilities. So again, these are some of the options that, as I'm working with families, we're going through what is possible, what is your goals, and how do we see if they are a good fit for you for a period of time, and perhaps do we need to zig and zag later. Next slide. So home care, this is just, again, national averages in this area, Florida numbers. Cost for home care is about $28 to $30 per hour. The service time can be anything from 1 hour to 24 hours. But today, post-COVID, a lot of the home care agency requires a 4-hour minimum because their caregivers don't want to do a 2 hours or 1 hour at each of the houses. They'd like to do a bulk of hours. And so sometimes there is a 4-hour minimum for home care coming into the home and providing support. Next slide. What is independent living? So as you ladies are living in independent living has a hotel license. They are not there to provide activities of daily living. They don't provide medication management, and they do not to provide a continuity of care, meaning that they're not meeting with physical therapy, occupational therapy, wound care providers. They're not managing your activities of daily living. They do provide rent, transportation, food, activities, housekeeping. And this is just, again, some averages of apartments, whether they be studios, one bedroom deluxe, 2 bedrooms. This is just, again, some options. And this is just ballpark numbers. Assisted living is the next slide, I think. So assisted living, this is the cost. So again, these are ranges for studio. a shared apartment, a studio, a 1-bedroom, 2-bedroom, and this includes, again, rent, transportation, food, activities, housekeeping. They also provide laundry services, typically at assisted living, and what they can provide is levels of care as needed. And we're going to refer to that as activities of daily living. So help with medication management, which would be separate, and then activities of daily living, showering, dressing, incontinent care, help with transferring, helping getting to meals, and to activities. So typically nationally, and again, I'm giving some numbers, medication management in an assisted living is anywhere between $300 and $650 a month, depending on how many medications and how many med passes. Are we doing medications once a day and you have one pill, or are we doing them 4 times a day and we actually have 20 pills, right? So again, what are those medications, how complicated they are? And this is just a ballpark figure for medication management. And then on top of that, if you needed activities of daily living help, showering, dressing, incontinent care, there could be levels of care. I included 4 here. I was just meeting with a director of sales and marketing at one of the assisted living communities, and she said she actually has 7 levels. So again, typically communities have 4 levels, but 7 was a little bit more than I've heard before. So again, it could be different than this. This is just, again, for the sake of education, we'll just say that there's about 4 levels. And this is typically is about as high as they go is 1,600, even in the highest level. And that would mean a lot of care, round the clock care, queuing, perhaps hourly checks even. Next slide. So what is memory care? Memory care, again, can be a shared apartment, a private studio apartment. It includes, again, these are just some ballpark numbers, rent, transportation, food, activities, housekeeping, laundry assistance. It's a secure and protected environment. And typically in memory care, there is 1 level of payment. It's not levels of care. They include all levels of care because I know at some point you're going to need help with bathing, dressing, grooming, escorting, med management. And so typically the rent would include all levels of care. And they do, again, help with activities of daily living. And they also can, at the end of life, bring in a third party, such as hospice, for end of life if needed. Next slide. What is respite care? So respite care can be in an assisted living. Assisted livings, this is, again, a range for the day. So again, if you wanted to have a loved one in a assisted living or memory care while you were having perhaps a surgery, visiting your family, going on a cruise, needing sort of a respite break, this would be what it typically costs in this area. Typically, there is a 2-week minimum, just because it's a lot of paperwork to do. But again, all care is included with that. Again, medication management, dressing, bathing, transferring, and incontinent help. So again, these are good to know ranges because again, there is always that idea of taking a respite of 2 weeks a couple times a year, just so that you as a caregiver can take a break. Next slide. And what is daycare? So daycare can be a half-a-day program, a full-day program, and this is where perhaps a meal is included, snacks included, lots of activities, exercise, perhaps an art project. But again, a half day here is typically about $75, and for a full day, about $150. And sometimes the VA actually will cover this as well as long-term care insurance. So the VA benefit sometimes does cover a home care benefit, which can actually transfer over to the daycare benefit. Next slide. Aid in attendance. I want to speak a little bit about the benefit aid in attendance. Aid in attendance is a federal pension for someone who has served during wartime or their surviving spouse It can also include the veteran and the spouse. So again, I'll give you a slide on that. And if Sherry would like, if anybody would like that information, I can forward that to Sherry and then she could share it with you. But again, it's a veteran's benefit for somebody who actually served during wartime. Doesn't mean you need to be in battle, but you can be stateside, but it needs to be a period of war. You have to be 65 or older. It is designed for financial assistance. So again, if you have $3 million, you're not going to qualify. If you have $60,000, you're probably going to qualify. But again, it's designed to provide a financial assistance for the veteran and their spouse or the surviving spouse of a veteran. It helps offset the cost of care for those who need assistance in an assisted living. The rate for someone to get home care is far less. That benefit is maybe $400 per month versus about $2,200 for that veteran. So significantly different in cost that you could get from aid and attendance, depending on if you're in a facility or if you're at home trying to get that benefit. Next slide, please. So again, this is a card that I created, and Sherry, if you'd like these forwarded to you, I can. This is who is most likely to qualify. So these are, again, the dates of service at the top part of this slide. And then if you are married to a veteran at the time of them passing, or you require, again, assistance from someone else to perform activities of daily living, and that you were paying for care, and you will soon outlive the income that you have. So again, this is why somebody goes for the aid and attendance benefits. These are the qualifiers, again, dates of service and needing actual help. Next slide. This is the current 2023 benefits. So 2 married veterans, 35, 36 per month, up to, right? And then veteran and their spouse. So these are 2 people living in a assisted living or assisted living memory care and getting help with care. You need at least 2 helps of something and an assisted living. A single veteran, again, living in an assisted living or memory care, needing help. You can't live in an independent living or assisted living and need no help. You need to get some activities of daily living assistance, or a surviving spouse of a veteran. So this is a great benefit. Encourage everybody to look into this if possible, because again, it is a wonderful way to offset the cost of living in a assisted living or memory care. It cannot be used in an independent living. So again, next slide. What is long-term care insurance? So again, this is really important to know. This is long-term care. So years ago, we used to talk about someone living in a nursing home. Grandma had to move to a nursing home, or my parent had to move to a nursing home. We don't use that term anymore. We call it a long-term care facility. So again, if somebody had to go from a hospital stay to a rehab stay and they could not stand, bear weight, and pivot in the state of Florida, they could be eligible for going to a long-term care facility. This is the average cost, $6,000 to $12,000 per month. All care would be included in the rent. They do manage medications, dressing, bathing, transferring. It can either be private pay for that period, again, that they're there, or it could be under Medicaid. You can also use the VA aid and attendance benefit to offset it. And sometimes people use long-term care to offset it. In the state of Florida, we have 3 different level licenses. So again, depending on what kind of care you need, perhaps instead of going to a long-term care facility, or again, old name nursing home, you could go to an assisted living with a high level of license as opposed to a nursing home and paying almost double the cost. So again, that's when I work with families and figure out what are the activities of daily living they need help with, and could they qualify for an assisted living versus a long-term care facility in order to save money. Next slide, please. Long-term care insurance. So long-term care insurance is something that people typically buy in their 50s, 60s. They pay for it until the time in which they move into perhaps an assisted living or memory care. It is an insurance that you buy, again, when you're in very good health. You pay for it yearly. Premiums have been going up, people tell me. And what it is actually for is for someone to perhaps live in an assisted living or memory care, or even have home care, and it offsets the cost because you've sort of paid for this benefit, and you can access it if you need care. And again, they're very specific about the 2 activities of daily living that you need help with, and documentation from your doctor that you actually need that, and that there is either facility providing that benefit or an entity like a home care agency that is providing a very documented care plan. So again, long-term care insurance is really important. And if somebody has that and wants to know a little bit more about questions to ask your long-term care provider, such as Genworth, John Hancock, CNA, Bright House, let me know, and I have a list of questions that can be asked of your long-term care insurance to better understand the benefit, and you can put that in your emergency binder so that your children know what your benefit is in 2023. One of the things, get your updated policy for actually March of 2023. Sorry about that. And the reason is I want you to know what your benefit is today. I want you to know when your anniversary date is, so that if you're thinking about accessing this benefit, I want you to know when your policy might increase because you have the inflationary rider. So again, just note to self, if you do have a long-term care policy and you want to know what your value is today, it's really important to kind of understand how that could work in the future for your financial planning. Next slide. This is, again, some of the terms that you'll be looking at. And I do have, again, paperwork that Maureen created on understanding your benefits, some questions to ask your long-term care provider that you purchased it from. So what is your elimination days? Is it 0 days, 30 days, 60, 90, 100 days? And what is my day rate for home care? Is it 100% of the value of assisted living, or is it half the value? So again, these are some questions to ask. What is my current day rate for assisted living? I know when I bought it, it was $100 a day, but because I've been paying the inflationary rider, I now have $275 a day. These are, again, what is my day rate for assisted living? What's my day rate for home care? And again, these are some of the questions you ask in order to get your ducks in a row. And again, forward thinking about, if I need care, where will the money come from? Which money should I tap first? Or which money should I tap first for my loved one? Next slide. This is just, again, how $100 a day policy translates to living in perhaps a memory care. If you had $100 a day times 30 days in a month, it's a $3,000 benefit if you activate that policy. If you have $250 a day at 30 days in a month, that's a $7,500 per month value. And typically memory cares aren't $7,500. They might be $5,500 or $6,000 a month, but $7,500 would be a lot of money. $7,500 is a lot of money. So perhaps you're drawing down on the whole pot of money much slower because you're not using the full amount per month. Next slide. Again, one of the questions we want to ask is, what is the day rate for nursing home? Sometimes policies years ago, 20 years ago, 30 years ago, when people bought them, they referred to either home care or nursing care. And in some policies, nursing care really does mean long-term care facilities. Sometimes it really does mean assisted living. So it's important to know the verbiage and how that verbiage actually translates to 2023. So it is important to every once in a while talk to your long-term care provider and ask them these questions. Does it cover assisted living? What's the day rate? Or does it cover nursing home or long-term care facilities? And then again, always check on the description. how do they describe it? Is this policy written for 3 years, 4 years, 5 years, or is it unlimited? Some people have an unlimited policy, and so I encourage them to use that. I had met a woman yesterday who was 89 years old, and she had $280 a day in long-term care insurance, and she's thinking about moving to an independent living. And I said, you're using a cane, you're a little wobbly, you have no children here. Why would you move to an independent living? And she said, well, all my friends are moving there. And I said, but let's go through the cost of you living in an independent living with home care. Remember, you still have to burn through the 100 days of elimination. Let's do a comparison of 6 months and a year in both of these places. It turns out when we compared the cost that she'd be paying for home care and the amount that she'd be paying in the independent living, that came out at $60,000 a year. And the assisted living, once we burned through those elimination days and the first 100 days that she was there, exactly 3.5 months, her total out-of-pocket expense, really apples to apples, 1 bedroom at an independent living to a 1 bedroom at assisted living, her out-of-pocket expense was $27,000. So $60,000 to $27,000. It was a huge gap in amount of money. And I said, at 89 years old with a walker, I'm not sure you're going to be safe in a independent living for long. And if you look at the money, it doesn't even make sense. I don't know how you could justify paying out that money. And then when you finally do need to move to an assisted living, perhaps the one that you want isn't even available. You should be making plans to go there at the age that you are and with this wonderful benefit that you have. So again, it's kind of looking at that value. What is that worth? And how does that translate to today's value and what is out there? Next slide. And how do I start a claim? So a lot of people ask me, how do I start a claim? One of the biggest things is, again, call the company, get the paperwork sent to you. Start with home care. I always try to help people start with home care first. So we start burning through those elimination days. It'd be better to pay a home care agency $30 an hour times 4 hours, $120 a day, versus perhaps an assisted living at $200 a day. So could we use home care at home to burn off the elimination days? And how many hours of home care in the eyes of your long-term care is equal to a day? Is it 1 hour, 2 hours? Is there a minimum at all? So again, those are some of the questions that I have listed on my outline for asking your long-term care provider, so that you just understand, is there no minimum? The minimum really requires what the home care agency has. So again, one of my things that I have people start looking at is assisted livings or memory cares. What do they cost, and how are we going to work backwards into the cost, into the finances that you have and the finances that you may have through coming through your long-term care insurance. Next slide. Again, not everything you need can be found on Google, and that's why you're here in this support group, right? Don't leave important things to internet searches. I was just talking to a director of sales and marketing, and she said, do you realize that a placeformomcaring.com spends huge amounts of money on Google ads that you think you're actually putting your information in and looking to get a tour at a certain independent living or assisted living community, only to find out that a Place for Mom has captured your information and sent it out to a 50-mile radius. So it's really important that, again, you work with trusted advisors. Don't ever put your information on the internet. Make sure that, again, you're working with trusted people. And again, this is a great place to start as a support group, so that, again, everybody's learning from each other. Next slide. As I tell my families, it's always better to be 5 years too early than 5 minutes too late. Next slide. So again, one of the things I do for families is simplify the process so that they don't have to think about all these things. I have to think about all these things, and I have to kind of pull the pieces together for them, give them options. I try to save my families time and money from running around to all the different communities. I try to figure out which ones they would be best cared for in, which ones make sense for their financial needs and their medical needs. And that's why I've started my company. So again, next slide. Again, my name is Lisa Honka, and I'm a senior living advisor. If you have any questions, certainly reach out to Sherry. She can forward things to me.